Hi guys, Stanley Keys here at Optometry Evolution. Hope everybody's keeping well. I just thought in this very strange period for us all and how optometry practice is being affected, it'd be useful to take a few minutes and talk about red eyes. I think most practices now in the UK are pretty much just carrying out emergency work, whether that's face-to-face or in fact, just telephone and video consultations for patients. So we're really down to just trying to figure out which patients really need to be seen by somebody because they've got a serious eye condition. So I thought let's take the topic of red eye, spend 3 or 4 minutes and just go through the sort of questions that we might ask whenever we're triaging these patients to see whether they do genuinely need to be seen by somebody. The very top of my list, if I take a call, is whether that patient is having any pain, and we need to differentiate pain versus discomfort. So if it's genuine pain, then immediately we're thinking about something a little bit more serious, potentially an ulcer, potentially an iritis, potentially an injury. So something that could potentially harm the eye or harm the vision long term. So that's a good sort of opening question just to sort of sort out the more serious cases. So number 1, pain. Number 2, is there a history of any type of injury, foreign body, abrasion? So has there been something mechanical that has happened to the eye that again could be causing damage? And again, a lot of these patients do need to be seen if there's something needing to be got out of the eye or the extent of an injury may be investigated. So has there been any sort of mechanical injury? Third question, has the vision been affected? So again, a bit like pain, if the vision is significantly affected, then it really means that there is something more serious happening to the eye. So the vision could be affected for a number of reasons. It could be an ulcer, it could be something on the cornea which is rendering the cornea very clouded. So obviously this is something that needs to be investigated. Some inflammatory conditions may cause changes at the macula. So again, with the vision being threatened, this is something that needs to be checked. Certain conditions may affect the optic nerve head as well. So if the vision is significantly affected, then that patient needs to be seen. A very useful symptom, so number 4 on our list, is whether the patient is photophobic. So again, that if the patient has some degree of photophobia, if they're very sensitive to light, some patients, really have to be in a dark room that is so severe. That implies that there's some degree of inflammation in the eye. So it could be sort of a primary inflammation such as iritis, or it could be inflammation sort of secondary to an injury or to an ulcer and so on. Either way, again, this is somebody that needs treatment, needs investigation. So if there's photophobia, that really sort of heightens our suspicion. The next factor to consider, the next question, is whether that patient is a contact lens wearer. So painful red eye, contact lens wearer, quite often we have to think about the possibility of an ulcer. That could be a microbial keratitis, or it could be an acanthamoeba, which again is an incredibly serious condition. So we need to be aware if they are a contact lens wearer, particularly if they're extended wear and wearing their lenses overnight, or potentially not adhering to hygiene standards. The next question on my list is whether the patient has had some sort of recent surgery or invasive procedure to the eye, such as an injection for wet macular degeneration. Any recent treatment to the eye like that, there's always a small risk of endophthalmitis, which renders the eye very painful, very red, and the vision can really drop quite dramatically. So asking if the patient has had any recent surgery or previous surgery, so they may have had a corneal graft in the past or a trabeculectomy for glaucoma. If any of these eyes become red and particularly painful, again, even if it's a more long-standing operation, we need to know about it because it could be graft rejection or a blebitis or something in the glaucoma patient. The next question, and in fact the final question on my list, is whether the patient is feeling unwell in any way. So if they've got a temperature, if they're feeling a bit low, we think particularly things like orbital cellulitis, which can affect the patient systemically. So a red eye, maybe swollen eyelids, patients feeling unwell, got a temperature, these sorts of things, our suspicion is very high in terms of orbital cellulitis. Painful eye movements as well. Acute angle closure glaucoma renders the patient feeling unwell, pardon me, So they might have headaches, they might be vomiting and so on. So somebody with a very high pressure could be equally feeling unwell. So ask how the patient is feeling in themselves. So hopefully that little list is useful. So just to run through it. Number 1, is the eye painful? Number 2, any history of injury or abrasion, anything mechanical? Number 3, vision affected. 4, photophobia. 5, contact lens wear. 6, any recent or previous surgery. Number 7, is the patient feeling unwell in any sense? So in 5 minutes, that can't really be an exhaustive review of the topic of red eye, I'm afraid, but hopefully those little tips give you something to work on if you are fielding phone calls or FaceTiming patients and trying to triage and sussing out which ones really need to be seen. So I hope that's been useful. Please share it with colleagues if you feel that it has, and all the very best to everyone. Thank you.